Hey everybody, welcome back. In this lesson, we'll be discussing basic information relating to MIMS. MIMS, formerly known as PACS, is important to understand because it is a critical component of patient care. MIMS stands for Medical Image Management and Processing System. The FDA renamed PACS, the Picture Archiving and Communication System, to MIMS in April of 2021, which is why the name may be unfamiliar to you. MIMS was renamed because of parts of the 21st Century Cures Act that redefined what types of medical software are regulated by the FDA. Software functions just related to image and information storage or archiving were no longer regulated by the FDA. So the name Picture Archiving and Communication System no longer made sense. However, if a software function allows for a practitioner to manage patient care through the processing, manipulation, enhancement, or review of patient images or information, it is regulated by the FDA. And that's why MIMS makes more sense. It stands for Medical Image Management and Processing System. So what is MIMS? A complete MIMS system has multiple components that work together. These components include acquisition devices, such as modality-specific devices like the X-ray room or the CT scanner that capture the images and transmit them to the workstations, also the workstations themselves, and viewing stations. Then there are the networks, which is how all of these things are communicated back and forth, and the archive servers, where images are stored and maintained. You can think of the network as a highway with exits and entrance ramps, and it's designed to process digital MIMS traffic, which is any diagnostic image and the information associated with it. The next component is the archive of the MIMS, which is where the images are stored and maintained. It is important to note that federal regulations require us to maintain images in a storage component in 2 locations in case of a disaster or network downtime. There is short-term storage, which allows for easy access of images, and long-term storage, which, while still accessible, will take a little longer to pull the information from the archives. The next component we have is the database, which is the heart of the MIMS system. It is essentially responsible for the organization and management of our images and any associated information. Finally, we have our MIMS broker, which processes messages between the MIMS, the Radiology Information System, that's the RIS, the Hospital Information System, or HIS, or the Electronic Medical Record, also called the EMR. There were a lot of acronyms in that last sentence. All of those acronyms relate back to the overall MIMS system. So let's break those down. The Radiology Information System, or RIS, is what the staff in the radiology department use for daily workflow activities, such as registering patients for exams or feeding our work lists. Most importantly, the RIS is responsible for generating exam accession numbers, which are what we use along with the patient's medical record number to look up associated images within the MIMS. The similar-sounding HIS stands for Hospital Information System, and it is a system designed to manage operational and healthcare data for the wider clinical setting. EMR stands for the Electronic Medical Record, which contains all of the standard medical record and clinical data gathered in one provider's office, such as a primary care physician. To communicate information like what's in the EMR across different facilities, providers need to consult the EHR, or the Electronic Health Record. You're probably familiar with the 2 most common EHR and EMR providers, Cerner and Epic. One final acronym related to MIMS that you'll need to be familiar with is DICOM. DICOM stands for Digital Imaging and Communications in Medicine. DICOM is a federally regulated international messaging standard that is designed to function on all MIMS systems, regardless of the vendor and regardless of the facility. DICOM acts like a universal language, allowing for different systems in medical imaging to talk to one another. Because there are a lot of different MIMS vendors, DICOM is critical for the sharing of patient images and information in a way that is accessible and HIPAA compliant. If all that feels really confusing to you, think about DICOM like a PDF or a GIF, which can be read by multiple different types of devices regardless of the vendor. To sum up, PACS, or Picture Archiving and Communication System, was renamed to MIMS, which stands for Medical Imaging Management and Processing System. This is because only software that relates to the processing, manipulation, and review of images and information falls under federal regulations' definition of a medical device. A complete MIMS consists of acquisition devices, a network that processes digital images, a database that organizes and manages images and associated information, and a MIMS broker, which processes messages between the MIMS, the RIS, the HIS, or the EMR. All of these images are distributed in DICOM format, which is the international standard that is designed to function with all MIMS systems, regardless of the vendor or facility. Hey everybody, welcome back. This lesson will discuss the details of MIMS and networking. Remember, MIMS stands for Medical Image Management and Processing System. MIMS is a system that has multiple components that work together that allow healthcare workers to process, manipulate, and/or review patient images. It is important to understand how MIMS functions within a network in case you ever need to troubleshoot an issue with image distribution. First, let's talk about networks in general. A network consists of computers that are all connected through one another somehow. A network really serves as an infrastructure that handles informational transactions between multiple parties. For example, a network allows information to be shared from MIMS to the billing department or to the radiologist for image review and dictation. Networks are extremely important in any healthcare setting. A network consists of both hardware and software components. Hardware is the physical, tangible components of a network, so things like CPUs. Software is a set of instructions that will be performed by the hardware. If you're working at a very small office, the type of network you're using is called a local area network, or LAN. If you're working in a larger facility with multiple LANs connected, or if you're communicating with the facility across the country, you're using a wide area network, or WAN. It's important to understand the difference between the two and which type your facility uses, because they have different levels of security. LANs have stronger security because they are controlled by a single organization and information does not travel as far. WANs have lower security because of how WANs transmit data and how far the data has to travel. Think of it this way. The more people using the network, the more opportunity for security to be breached. It is also important to understand the difference between intranet, extranet, and internet. Which one you're using will determine the level of security, as well as how quickly information can be distributed. The intranet is one or more networks under the control of a single organization and will be very specific to the facility that is using it. The intranet creates connections inside of an organization. The extranet is an internally managed network that has limited connectivity to other networks. The extranet creates connections beyond an organization, such as with vendors or patients. The internet, or the World Wide Web we're all familiar with, creates connections between organizations and computers around the world. The last thing we need to talk about regarding generic networks is called a network switch. There are three kinds of network switches: a hub, a bridge, and a router. The different types of switches have differing levels of security and ability to handle different amounts of information. A network hub is a passive device and does not recognize who the information is going to or where it came from, and allows all computers that are connected to it to transmit and receive data. The network bridge is more active and examines all of the data that is being sent, filters it, and allows for greater management of communication on a network by its users. Both hubs and bridges can only connect devices on the same network. Most healthcare facilities will be using a network router, which not only examines and filters all the data it receives, it also improves security by limiting the scope of the data and identifies the sender and the recipients. Routers can not only be used on a very large network, but it can also connect devices on different networks. The type of switches within a network determine how much information a network can handle. In a large facility with a large network, the network would have to have multiple switches to expand the bandwidth, or how much information can flow through the network. In a smaller facility, the network would have fewer switches and would not need as much bandwidth. Now that we understand how networks work and how information is passed through a network, let's talk about the two kinds of MIMS networks. To start with, we'll talk about server-based systems, which is also known as client-server architecture. In this system, images are sent directly to the MIMS servers, and then they're interpreted from the MIMS servers at the radiologist reading stations. So in order to view these images in the system, a radiologist must access the MIMS network from a dedicated MIMS station. So there are some advantages and disadvantages to this arrangement. As far as advantages, any exam can be opened from any MIMS workstation because all of those reading stations are connected back to the server and all of the images are stored on the server. Another advantage is that only one radiologist can open the exam to interpret it. So if the exam is already opened by one radiologist, the second radiologist would get a warning letting them know that someone else is already interpreting that examination. Something else that's advantageous of a server-based system is that all prior exams are immediately accessible to the radiologist. And this makes sense because the MIMS reading station is connected directly to the MIMS server, which is the same place where all of the prior exams are archived as well. So that's the advantages of server-based systems, but obviously we have some disadvantages as well. For example, if the MIMS server fails, the entire system fails. There's no way to access the original images from a reading station except through the MIMS servers. The other thing to remember is that this system runs on one network, and so the system can become bogged down by the massive amount of data flowing through the network. A very similar MIMS network is what we call cloud-based systems, or cloud computing. These systems are nearly identical to the server-based system, but with one exception. In this organization, the imaging equipment still sends images to the MIMS server, and the servers are still connected to the radiologist reading stations. The only difference is that the exams can be viewed from any computer with access to the cloud. So these systems still have dedicated MIMS workstations, but the MIMS network is accessed through the cloud on the internet, which is why it's called a cloud-based system. There is not a dedicated MIMS network. The obvious advantage here is that exams can be accessed from any computer with internet access. As far as disadvantages, though, images viewed on normal desktop monitors are not going to be of diagnostic quality. So even though we can view these images from any internet-connected computer, we still have to have dedicated MIMS reading stations for the radiologists. Something else to keep in mind is that the speed of this entire system depends on the internet speed. So if the internet is bogged down, the entire MIMS network is going to be bogged down. And we still have the same problem that we have with the server-based systems. Because the radiologist must access the images through the MIMS server. If the MIMS server fails, then the entire network fails. To summarize all of this, a MIMS network consists of computers that are connected through one another and handles informational transactions between these computers. In a very small facility, a local area network or LAN would be used, whereas in a larger facility, a wide area network or WAN would be used. There are two kinds of MIMS networks commonly used. First is server-based systems that consist of MIMS servers and MIMS reading stations. And secondly, we also have cloud-based servers, which consist of MIMS servers, MIMS reading stations, and a cloud-based storage application that allows for any computer with internet access and access to the cloud to view the images stored in the MIMS server.
Hey everybody, welcome back to our lessons on patient care. In this lesson, we will discuss HIPAA, or the Health Insurance Portability and Accountability Act of 1996, its main provisions, and what they mean for your work with patients. It is essential to understand the basic provisions of HIPAA regulations to protect patient confidentiality and privacy and improve the care of your patients. Violating these regulations can lead to financial and/or criminal penalties for you and your employer. HIPAA is federal legislation that aims to simplify healthcare transactions, offer insurance coverage to workers transitioning between jobs, and, most important for our discussion, it establishes protections for individuals' health information. While there are a number of rules within HIPAA, it is helpful to remember many of them center on maintaining patient privacy and patient control over their medical information. There are 8 essential provisions and rules under HIPAA: healthcare access, portability, and renewability; administrative simplification, which includes provisions for preventing healthcare fraud and abuse and medical liability reform; privacy rule; security rule; enforcement rule; breach notification rule; omnibus rule; unique identifiers rule, or national provider identifier, or NPI. We will discuss each one of these rules individually. The healthcare access, portability, and renewability provision ensures that people will not lose their medical insurance coverage when they change or lose their jobs. This assurance comes from the law's requirement that people not be denied coverage for conditions covered under their previous healthcare insurance. This is particularly important for people with chronic or pre-existing conditions because it means that they cannot be denied insurance coverage for those conditions by future employers or policies purchased in the open marketplace. The next is the administrative simplification provision, which includes provisions for preventing healthcare fraud and abuse and medical liability reform. This section of HIPAA sets standards for the electronic transmission of financial and administrative transactions and mandates the establishment of national identifiers for providers, health insurance plans, and employers. When Dr. Smith bills an insurance company, he uses a standardized electronic format. This makes the transaction process smoother and reduces errors. The remaining provisions of HIPAA are referred to as rules. The first is the privacy rule. This rule establishes federal protections for protected or personal health information, or PHI, held by physicians, hospitals, or any healthcare provider, and it gives patients rights regarding their health information. Privacy and security are the best known aspects of HIPAA, and the ones that impact daily practice of healthcare workers the most. Healthcare providers should always ensure conversations about patients are held in private settings and avoid discussing patient details in public spaces, such as elevators or cafeterias, where unauthorized individuals might overhear. Additionally, healthcare workers should follow the minimum necessary rule when sharing patient information with others involved in care. Only disclose the minimum necessary information required, and only share patient information with the patient's family members or other entities if the patient has given explicit permission to do so. An example of this would be if one hospital wanted to share or disclose PHI with another hospital or any other entity, they are not allowed to do so without that patient's consent. This rule also provides patients the right to request and obtain a copy of their medical records. The next rule is the security rule. This rule sets standards, which must be followed by all healthcare providers, for patient health information security in electronic form. It requires that all healthcare providers establish policies and processes for protection against breaches. An example of this might be the use of encrypted software to store and transmit electronic patient data, ensuring no unauthorized access. Whether paper-based or electronic, facilities and healthcare workers should always ensure patient records are secure. This might mean logging out of computer systems, locking file cabinets, or using password-protected software. The third rule is the enforcement rule. This provision outlines procedures for investigations, hearings, and the penalties for violations of HIPAA. This rule works to ensure there are consequences for institutions that fail to protect patient data. Facilities and/or providers face penalties based on the nature and extent of the violation and the harm resulting from it. Related to the enforcement rule is the breach notification rule, which says that if a healthcare facility or provider is the victim of an information breach, they and their business associates must notify all patients of the possible breach of their protected health information. For instance, if a hospital's database is hacked and patient data is compromised, the hospital must notify the affected individuals, the Secretary of Health and Human Services, and, in some cases, the media. Over 25 hospitals nationwide have suffered ransomware attacks, computer hacks where hospital personnel are blocked from accessing patient information until they pay a ransom to the hackers. These attacks are an example of one which compromises patient data and must be reported under HIPAA regulations. The Unique Identifiers Rule was created to simplify the administrative process around providing healthcare. This provision required the adoption of a National Provider Identifier, or NPI, to serve as a standard unique identifier for healthcare providers for use in the healthcare system. This means that every healthcare provider in the country has a unique 10-digit number that distinguishes her or him in the healthcare system. This simplifies transactions and communications between entities. In 2013, the Omnibus Rule was implemented, impacting aspects of the privacy, security, enforcement, and breach notification rules. A key part of the Omnibus Rule was expanding the responsibilities of business associates. So if a hospital uses a third-party billing company, that company is also liable for ensuring the protection of patient data. In summary, the Health Insurance Portability and Accountability Act of 1996, or HIPAA, is a set of regulations that provide people with greater access to, control over, and degree of privacy concerning their healthcare and personal healthcare information. The central provisions are healthcare access, portability, and renewability, prevention of healthcare fraud and abuse, administrative simplification, medical liability reform, privacy rule, security rule, enforcement rule, breach notification rule, omnibus rule, unique identifiers rule, or National Provider Identifier, or NPI. These provisions outline the rights patients have to receive healthcare coverage and maintain the privacy of their health information, as well as dictating the responsibility healthcare providers have to manage and protect that information and to simplify the process of obtaining. Welcome back to our lessons on guidelines and regulations governing patient care. In this video, we will be discussing the common ways healthcare workers might violate HIPAA regulations and ways these violations may be avoided. Being diligent in upholding HIPAA regulations is essential to providing quality, trustworthy patient care, and not doing so could lead to professional discipline or legal liability for you as a practitioner. Let's begin with the most common HIPAA violation: the unauthorized sharing of a patient's protected health information, or PHI. PHI includes any patient health information falling into these three basic categories: health conditions, treatment, and billing. The improper sharing of patient information can happen in many different ways, depending on the patient, audience, and context. Sharing this personal patient information in any way with unauthorized personnel, including friends, family, or colleagues who are not directly involved in the patient's care, is a HIPAA violation. Information should only be shared on a need-to-know basis. Here are some common examples of information sharing violations and how to avoid them. Prohibition of photographs. In a world of cell phone cameras, there may be cases or experiences that you feel you want to photograph, either for reference or memory. But taking photographs of patients, even ones that exclude their faces or patient information like their charts or diagnostic images, can easily lead to a breach of patient confidentiality. To avoid this violation, never photograph patients, their charts, or diagnostic images with a cell phone or any other device. Even if you never share these images electronically, their presence, stored either on your device or in the cloud, makes them open to piracy and makes you vulnerable to discipline. Handling high-profile patients. Related to the prohibition of photographs is a warning to be aware that when treating celebrities or individuals of public interest, extra caution is required. High-profile patients are likely to have more at stake, personally, financially, or politically, with keeping their private health information private. At the same time, you might be motivated to share the story of having treated or getting to meet a VIP, and there might be news reporters actively seeking updates on a celebrity's health. An example of this violation is in 2016, a nurse at Cedars-Sinai Medical Center in Los Angeles was fired after she posted a photo of Justin Bieber's medical records on Snapchat. Additionally, several doctors have been fired, or in some cases, imprisoned, for accessing patient records without authorization. An example of this is the 2003 case where a UCLA surgeon was sentenced to prison for sharing the PHI of celebrities like Britney Spears, Tom Hanks, and others. To avoid making these violations, never notify the press or any unauthorized person about a high-profile patient's medical treatment. If approached by the media, do not confirm the celebrity's presence and direct them to speak to your facility's director. Don't take photographs with or ask for autographs from a celebrity receiving treatment. Certainly don't make social media posts about or even acknowledge to anyone not involved directly with their treatment a celebrity's presence at your facility. Gossiping or speaking openly. Even if you are only discussing a patient with other personnel at your facility, you might be violating the regulation against improper sharing of PHI. Discussing patients' conditions or treatments in elevators, cafeterias, or other public areas where conversations can be overheard can lead to a HIPAA violation. Texting patient information. This also applies to texting. Using non-secure text messaging to send patient information can easily lead to breaches, especially if the device is lost or intercepted. Unlocked computer screens and unsecured files. Failing to secure physical and electronic records can lead to unauthorized access. This includes leaving computer screens with patient data open and unattended, leaving a patient record on a counter of the break room, or not storing physical files securely. To avoid making these violations, be aware of your surroundings and the people who may overhear conversations. Only discuss protected health information with personnel directly involved in that patient's care, and never communicate patient information over a non-secure message app. You should be sure to refile physical records and lock or log out of your computer screen when walking away from the workstation. Facilities should have clear policies regarding the electronic sharing of PHI and utilize secure methods for doing so, like encrypted email or secure patient portals. Other areas to discuss in regards to protecting a patient's PHI are avoiding improperly addressed communications and releasing information of deceased patients. Improperly addressed communications. Improperly addressed communications consists of mistakenly sending patient information to the wrong patient, whether via email, fax, or mail. Sending information to recipients other than the patient or those authorized to view their health information is a clear HIPAA violation. Release of information after a patient is deceased. Protection of PHI extends even after a patient's death. Disclosing a deceased patient's health information without proper authorization or in violation of state laws is a violation of HIPAA protections. To avoid these violations, you should also double-check a patient's medical record to ensure they have clearly indicated with whom their personal health. To avoid these violations, it is important that physical patient files be kept either on your person or filed in a locked filing cabinet at all times. Be sure that physical patient files are disposed of properly, typically by means of shredding or in secure, locked trash containers where they are kept until removed for bulk shredding. Next is the loss or improper disposal of electronic patient files. Mobile devices or laptops containing patient information can be lost or stolen, leading to a data breach. Additionally, disposing of electronic devices that contain PHI by simply throwing them away is a clear violation of HIPAA regulations. To avoid these violations, it is important that, regardless of the device, that they are encrypted, and ideally, patient PHI is stored in secure portals. It is best to avoid using personal devices for this reason. Hospital-issued devices have higher levels of encryption that protect against breach. This way, even if an electronic device is stolen, it would be difficult for thieves to unlock it, and if they were successful, patient information would be protected within a secure portal. When disposing of electronic devices that contain patient health records, all data, once it is backed up on the new system, must be deleted. However, simply deleting files is not sufficient, as deleted data can often be recovered. It is recommended facilities use software designed to permanently erase data or perform a full reformat of the storage device. For added security, physical destruction of the storage medium is recommended. This can be achieved through degaussing, using a high-powered magnet to disrupt the magnetic field of the storage media, rendering it unusable. Shredding, physically shredding hard drives, disks, or other storage media into small pieces. Crushing, employing devices that punch holes through the hard drive or crush it, making data unrecoverable. In summary, it is important to understand the areas of providing patient care which lead to common HIPAA violations and what you can do to avoid committing these violations. Remember that first and foremost, HIPAA works to protect patients' privacy. So talking openly about their care, taking pictures of them or their charts, leaving their information open on your computer, and improperly disposing of documents related to their PHI all open you up to discipline for violating that privacy. Additionally, be sure you understand the criteria for obtaining consent for procedures, how to encrypt your electronic devices, and where to record patient information so it is secure.